Hi, my name is Dr. John Wessling, and today I want to talk to you about sciatic and leg pain. Sciatic is a pain or a burning sensation or a numbness or tingling from irritation of the sciatic nerve. Sciatic pain typically is felt from the lower back to behind the thigh, radiating here down below the knee to the outer part of the lower leg into the top of the foot. Now the sciatic nerve is the largest nerve in our body. Now here I have a plastic model of a spine. These are two vertebrae. This is the disc. These are the nerves. And over here we see a bulging disc. Now sciatica is most commonly a result of a bulging disc or even a herniated disc in the lower back that compresses that nerve. And there are other causes of irritation that can occur to the sciatic that can reproduce the symptoms of sciatic pain, such as narrowing of the spinal canal, which is another name for spinal stenosis, or bone spurs caused by arthritis, or pinched nerves caused by an injury. Another cause of sciatic may be from a condition called a piriformis syndrome. The sciatic nerve passes through layers of a muscle called the piriformis muscle here in the buttocks, into the hip, and then also runs down here into the upper thigh. So when this piriformis muscle becomes shortened and tight, this muscle now when you contract or when you try to stretch or try to bend, it will compress and irritate the sciatic nerve, causing you increased pain. Now one of the major causes that I have found as a chiropractor is this one area right here called the cerebellum, here in the back of the brain. And the cerebellum basically controls three things. It controls your balance and coordinated movement, it coordinates eye movement, and it also controls all of our postural spinal muscles, which is very important when it comes to sciatic. So when the cerebellum isn't functioning properly, or it isn't doing what it's supposed to be doing, these muscles here in the lower back and in the hip will spasm, causing the spinal joints to lock up, creating little to no motion in the lower back region. Now, the only way the spinal joints get nutrients in the disc space is through motion. So if there is little to no motion in these spinal joints, and there is a lot of tightness and tension in the muscles while you're bending or moving, then there will be considerable binding and torque put upon these discs, which will start the disc to then bulge and then to herniate. And if it isn't addressed over time, they start to wear down or degenerate, causing arthritis, irritating the nerve going down in the leg. And that is why you get sciatic. Now the confusing thing about sciatica is that just about anything that irritates the lower back can cause sciatic pain, whether it be the spinal joints, the nerve roots, the disc, or even the muscles. All these can cause pain that feels and looks like sciatic. So this is why so many treatments for sciatic fail. They're actually treating the wrong thing. Many sciatic sufferers try muscle relaxers, physical therapy, exercise, and even injections with little or no help. Now we take a different approach to the treatment and prevention of sciatic. We offer a unique sciatic pain relief program to first of all identify the cause and then eliminate sciatic. After we do a thorough neurological examination, we're then able to determine which part of your nervous system is not functioning properly. And as I said earlier, in many cases, many sciatic patients, we may find a malfunctioning cerebellum at fault. And if we find that we can help you, we offer a comprehensive treatment for fast results. First of all, we use brain-based rehab to get your brain and nervous system functioning properly again. We may also do spinal decompression to decompress the nerves and also to rehabilitate these discs here. We may do active rehabilitative maneuvers, which is designed to effectively transition from a previously painful range of motion to one that is complete and totally free of pain when you move. So with this approach, sciatic doesn't have a chance. The last thing is we examine for any metabolic or hormonal imbalances that could be contributing to your lower back and sciatic condition. So often there are chemical and inflammatory causes to sciatic pain. Laboratory and clinical testing, including urine and saliva, is done to determine your underlying metabolic state. So the key to successfully treating sciatic pain is to restore function to your body in the form of therapy to your brain and to your nervous system. And then also correcting the metabolic imbalances and also rehabilitating your disc and muscles to minimize your chances of having a relapse. You see, we don't want this to ever happen to you again. So if you suffer from lower back and sciatic pain and would like to learn more about our sciatic relief treatment program, you may request a free report by filling out the information below, or you may schedule an appointment by calling our office at 316-262-3931.